Number one, what's the most common reason across the planet for aortic regurgitation? Is a damaged aortic valve from a rheumatic inflammatory process, or a dilated aortic root from syphilis. That would have made Maria really happy. Turned out that Arnold had the most common reason in this part of the planet, which is a congenital damaged bicuspid aortic valve. So the aortic valve, instead of having 3 cusps, has only 2. And as a result, is likely to undergo wear and tear. So that in your 40s, it breaks down and becomes leaky. Later, may even calcify and narrow. That's how Robin Williams got operated for aortic stenosis in his 50s. But Arnold Schwarzenegger, 44, goes in and they say, Arnold, you got aortic regurgitation, we need to replace the valve, you need to be on blood thinners. And he goes like, how can be on blood thinners? I'm an action hero, I jump from planes. And they say, well, let's do something creative. This is UCLA. We're going to get your pulmonic valve, which is normal, we're going to put it in the aortic area. Then we're going to get a cadaveric donor valve and put it in the pulmonic area. You don't need anticoagulation, it'll last longer. Turns out that, as John Lennon used to say, life is what happens to you when you're busy making plans, and he bled. They had to reopen him up 3 times. So he's got a scar from here to here that unless they Photoshop it, you see it on movies. And since the guy can't act, and the only reason why people go and see his movies is to admire his pectoralis major, unable to show his pectoralis major with his movie career in shambles, he had to reinvent himself as a politician with dire consequences for the state of California. And all of this because of a lousy bicuspid. So that presents itself with that click. Remember the click? Now, there is another guy who had aortic regurgitation, Abe Lincoln, A&A, Arnold and A. In this picture, taken by Alexander Gardner after Gettysburg, the foot of the president was fuzzy. Lincoln noticed it. He said, look at that, the foot is fuzzy. Now, it took a minute to take a picture in those years, so Alexander Gardner said, Mr. President, that's because you had brisk circulation. Remember the big jolt that makes you bob the head? The first fellow that had that was this boy named the Musset, who had syphilis, and his head was bobbing. He still called it the Musset sign. Lincoln had a Demusset equivalent. Why? The big jolt in systolic, followed by the tapering in diastole. How do you get that? Well, yes, you can get it from a screwed up valve, a la Schwarzenegger, but you can also get it from a humongously dilated aortic root from... yeah, well, we didn't want to give syphilis to Abe Lincoln. No, he's an angel. So we gave him Marfan syndrome. It turns out that nobody in his family had Marfan. He might have had syphilis because actually a letter recently surfaced where he wrote to a friend as a young man expressing fears for having gone with the lady of the night and possibly having caught something, so it might have been syphilis. Either way, aortic regurgitation is lots of noise. And what about the sperminator? Well, the sperminator, it's hard to get married to the sperminator. Look at her. And look at her now. Now, the Kennedy women age badly. But this is too much. Would it help you, the power of observation, if I were to tell you that her Uncle Jack had Addison's disease, that her mother had Addison's disease, and that her medical records were stolen from UCLA, probably for blackmailing? I can even envision hyperpigmented palmar creases. So again, keep a good eye. You can observe a lot by watching it. Next, loss of noise. Remember, first question, do you hear a murmur? Yes. Does it qualify as lots of noise, systole and diastole? The next one. 24-year-old med student comes to see you before an exam. She's anxious, she's got chest pain, and nothing else. And on exam, you pick up this. It's a rubbing, lots of noise. What it is a pericardial friction rub. Imagine the sac around the heart being inflamed. The two layers rubbing against each other, creating this crunchy, rubbing noise of that's diagnostic. Lots of noise, pericardial friction rub. More concerningly, she's got a few bad findings. Number one, she's short of breath. And that's a bad sign. Number 2, she's got neck veins distended to the neck. Why? Because if the sac is now filled with fluid, blood can come back and backs up in your neck. Then you listen to the lungs. If the lungs are clear, that's a tetra that is very suggestive of tamponade. What is tamponade? Lots of fluid in the pericardial sac, preventing the ventricles from expanding and filling. That's a life-threatening situation. How do you confirm it? Well, for the med students, because I won't be able to get into the details, you do a pulsus paradoxus. And if it's above 22, you have confirmed it and you drain it. So it's very important that you think about this thing, because the patients will show up. Tamponade. Famous VIP with tamponade. You are in Jerusalem. It's April 7, 2018. You're outside Damascus Gate, and you're watching 3 men being executed by an occupying imperial power. The execution started at 9 o'clock. It's been going on for close to 6 hours. All of a sudden, one of the 3 prisoners cries a loud shout and then dies. 2 hours later, one of the soldiers comes by and spears him to make sure that he's dead. And according to an eyewitness, out of the wound comes blood and water. And of course, there is another eyewitness, and it's the Shroud of Turin. I actually have a fascination with the Shroud of Turin, which according to me is the real thing. And again, this is from somebody who doesn't go to church, but is convinced that that is the real thing. In fact, the best site for the web on the Shroud, shroud.com, is kept by Barry Schwartz, who's an agnostic Jew who went to Turin with a group of scientists to photograph the Shroud. And I spoke to Barry and he says, I went to Turin for the trip. I'm an agnostic Jew. I'm still an agnostic Jew, but that thing is real. But whatever it is, there is blood on it. And that blood, by the way, is full of bilirubin. Why bilirubin? Because if you get scourged as badly as you got scourged, your red cells break down. And now you have bilirubin. Now, what's this blood and water thing? On the cross, you died of respiratory failure. The only way you could breathe was by pushing yourself through the knees, through the feet, and using your wrist as a fulcrum exhale. But if you took your time, the Romans got tired and they broke your legs. It was called the crurifragium. Then you couldn't breathe anymore and you died. Yeah. Otherwise, you died of respiratory failure. People that died in respiratory failure don't shout. According to 2 evangelists, they shout. So who shouts? People that break the heart. The rupture of the heart is a classic. And what he went through, remember the sweating of blood, which is a physical finding of distress, has been seen in blitz victims, rape victims, and people that are about to be executed. That's a lot of catecholamines, and you can break your heart. Now, if you break your heart, you flood the pericardial sac, and you get tamponade. And that's the theory that was put together by a pathologist in England. And that explains very well why 2 hours later, the blood has sediment. So that red cells first, and zero supernatant came out, as John said. Either way, there are not too many cases of somebody who survived this thing, and we have to believe it on faith. So folks, make sure that if somebody comes with a pericardial friction graft, or even without it, you suspect tamponade because they are tachycardic and tachypnic. You look at the neck veins. If they're distended, you listen to the lungs. They have to be clear. And then you do a pulsus paradoxus. And that is as good as technology. All right, next, lots of noise. True case. This is a 58-year-old guy that comes off the street, and he has some sort of congestion. The house staff thinks he has pneumonia. They put him in isolation because they think he may have TB. But they pick up a lots of noise thing. They think he has aortic regurgitation, the Arnold Schwarzenegger thing. And then they call me the following day, and they say, what do you think, Dr. Mangione? And here is what I heard. This murmur never ends. It's very different from the previous one. Let me mimic it for you. The previous one had something in systole and something in diastole, and they were separated. Very much like this. This thing is a never-ending to and fro, machinery-like, training tunnel, murmur that is continuous. We see this in pediatrics, in people that have an abnormal connection between the aorta and the pulmonary artery. It's called patent ductus arteriosus. But you don't get that at 55, because usually you die early. So I turn him around because it's best ordered in the back, and I see a scar. What happened, sir? Oh, I got stabbed, doc. But they took me to the hospital, they stitched me up, and I'm okay, except I have to say I went back a few times because I had lost muscle and strength in my arm, and I was getting short of breath. But they did a fancy study with a microphone and a jelly called echocardiogram, and they told me my heart was fine. So what was going on? Here is the power of clinical skills. The guy had been stabbed. There are two vessels here, a subclavian vein and a subclavian artery. The stabbing created a fistula, very much like the patent ductus arteriosus, but above it. That fistula stole blood from the arm, that's why it was was getting cold and weak, sending it to the lungs, the congestion that the house staff interpreted as tuberculosis, and the murmur was up here. So when they did an echocardiogram of the heart, they didn't pick it up. Why? They asked the wrong question. Remember, folks, if you ask a test based on the wrong question, you get the wrong answer. And then you embark on a path where tests beget tests. And at the end of the path, there is a surgeon, a lawyer, and an undertaker. Lots of noise. Patent ductus arteriosus. The last lots of noise. 75-year-old award-winning actor comes to see you, he's short of breath. And this, of course, is Henry Fonda, who died of heart failure. Congestive cardiomyopathy. When you have a humongous heart, your mitral valve gets leaky. You get mitral regurgitation. That's a lot of noise. Let's hear it. Let me show you. This is the first sound, and this is the second sound. This is systolic. There is a murmur going throughout systolic, touching S2. Anything that touches S2 is pathologic, and it's signifying mitral regurgitation. Anything that touches S2 is mitral regurgitation. But then, there is an extra sound with a rumbling noise in diastole. Why? All the blood they regurgitated in systole will have to rush forward, creating a functional rumble of mitral stenosis. So what you get is lots of noise, but different from the AR. Mostly of this type. Let's hear it. Still, lots of noise. And if it's lots of noise, work it out. So let's get back into the algorithm. The algorithm on the right side is the lots of noise algorithm. Bad aortic regurgitation, bad mitral regurgitation, pericardial friction valve, patent ductus arteriosus. Either way, if it's lots of noise, work it out. If it's not lots of noise, could it be only in diastole? Only in diastole. Is there anything normal in diastole? No, because the diastolic gradients are too feeble to generate turbulence. Hence, has to be pathologic. So if there is anything in diastole, work it out. What could it be? All right, let me give you this case. This is my basket case. So midlife crisis is a bad thing. When midlife crisis hits, a guy usually has three options: to divorce his wife and buy a convertible, marry a bimbo, and run for president of the United States. They didn't seem appealing to me. The fifth option is to go to Nepal. So I went to Nepal. And I was working this dilapidated clinic in the middle of nowhere without electricity, and having breakfast in the morning, I saw a guy being brought in by his son in a basket. It was my basket case. The son walked for 6 hours to bring dad, who was short of breath. So here's the story. By the way, to get to Nepal, I had to go through 15,000 feet passes. And since they figured out I might have had some problems, they wanted a medical certificate. I know enough medicine to steer clear as much as I can from dogs. So I don't have a doctor. I have a friend who does only autopsies. So he wrote, he's the best looking patient I've ever seen. 63-year-old villager comes to see you by basket in the mountains of Nepal. Thanks to a friendly translator, you understand he's been having increasing and debilitating shortness of breath. Examination at the apex reveals the following. Now, systole is clean. There is this long rumble in diastole, preceded by this extra sound, which is the mitral valve snapping open. So what's going on here? Everybody in the valve has rheumatic fever, which is an inflammatory process that damages the cardiac valves, mitral possibly being one. If the mitral valve gets narrow in diastole, there will be enough turbulence to make noise. This rumble in diastole is diagnostic of mitral stenosis. Now, mitral stenosis may also present with simply a snap of opening of the narrow valve. Tum-tara, tum-tara, tum-tara. Let me play it for you. Which, by the way, sounds a lot like this. Does anybody recognize this piece?
Yes.
Yes, this is Beethoven's Scherzo in the ninth. Let's play it again. Alright, so Beethoven dies of cirrhosis. The guy didn't drink much. And he was deaf. But we don't know whether he was deaf to the outside or really to the outside and the inside. Is it possible some people do have problems that prevent sound from the outside to get in, but they are very keen to the inner sounds? Is it possible he might have heard this sound? Can cirrhosis be associated with mitral stenosis? Absolutely. It's called cardiac cirrhosis from passive congestion. I don't know. Is it possible that you heard that as a rendition of that? Either way, folks, mitral stenosis, which, by the way, you can recognize at first sight. What you see unusual in this person with mitral stenosis is in the face, facies mitrali. She's got acrocyanosis. The distal parts of the body don't receive enough blood and they desaturate, they deoxygenate. The tip of the nose, the cheeks, the lips, typical of people that have slow flows because they have this duct called the narrow mitral valve. Alright, so we have seen now that in diastole you work it out. What about if it's in systole? The question is, does it touch S2? If it goes into S2, work it out. It's mitral regurgitation. So folks, the only one where you have to exercise judgment is the one that spares S2. The one that is a crescendo decrescendo systolic ejection in systole. The one that caused these two people to get cardiac surgery. And this person to get cardiac surgery. This, by the way, is the comment she made when Katrina destroyed Bologna. I don't know what people remember to that. But anyway, so the point is, what do they have in common? They used to have a systolic ejection murmur over the left sternal border, which in their case turned out to be aortic stenosis. Now notice, by the way, that Robin Williams, who came to my Two Brains lecture this morning. You see anything on Robin Williams' ears? He's got an earlobe crease, which means he's atherosclerotic. And that's how people nowadays get aortic stenosis. It's a feature of atherosclerosis, old age. Robin Williams is aging pretty badly. Anyway, that's the earlobe crease. So folks, if you're dealing with a murmur that spares the second sound, which is crescendo decrescendo, now you got a problem. Because it could be Robin Williams, who, by the way, must have had a murmur for a long time, but they didn't think about this as being aortic stenosis. They thought it was normal. Till Robin Williams passed out on stage. That's not a good way to make a diagnosis. So, what do? Let's say you pick up a murmur that spares S2, that is in systolic crescendo decrescendo ejection line. Number one, which is this thing. Number one, judge them the same way you judge people, by the company they keep. Now notice I didn't say judge lots of noise murmurs, they're all bad. I didn't say judge diastolic murmurs, they're all bad. I didn't say judge systolic regurgitant murmurs, the ones that touch S2, they're all bad. I said judge systolic ejection, the one that spares S2. And what do I mean by company? In cardiology, the only good company is no company. They should come with no symptoms, no passing out, no shortness of breath, no dizziness, no chest pain. They shouldn't have arterial pulses that are abnormal, delayed, reduced, no thrill on the precordium, no EKG hypertrophy, any of that, work it out. If the company is okay, 2 acoustic criteria. The bed murmur sounds like this. Crescendo decrescendo, no S2, loud, rough. The benign one would be more like this. Soft, early, good S2, the valve is moving. That's how you tell them apart. And what is the benign one? The benign one, folks, is an atherosclerotic process of the valve. We call it aortic sclerosis, but there is no transvalvular gradient. So it's not aortic stenosis. Very important to separate. So, once again, to move on to the lung sounds, before I do that, for the heart, pattern recognition, you need to listen to this thing 500 times, which means you need to get yourself some sounds. Or alternatively, use my algorithm. It can help you out. Now let's move to the lung. The lung means breath, adventitious, and transmitted. Breath, the sounds produced by air moving through a hollow tube. Everybody's got it. Adventitious, the extra sounds that only indicate pathology. What about transmitted voice sounds? You ask the person to say something, like, "Doctor, I'm going to sue you." And if you hear across the chest, it will tell you something about the characteristics of the tissue that the sound is traversing. Let's start with the breath sounds. Here's your trachea. If you put your stethoscope over your trachea, you would hear a sound like this. Inspiration, exhalation, silent pause, high-pitched, loud, close to 1,000 hertz, Darth Vader. But once that tube goes into the chest, it gets surrounded by a mantle of alveolar air. Okay, let me ask you, which transmits sound better? Air, liquid or solid? Solid. If you're waiting for the trolley of the streetcar named Desire, and you have no idea whether it's coming or not because you can't hear it, touch the tracks. Assuming they're not electrified, they'll vibrate before you can hear it. Solid, good transmitter. What about liquid? Very good. In fact, whales can communicate across the spans of oceans by singing. And part of the reason why they are beaching themselves, we put a lot of noise with our engines that confuses them. So the real problem is air. So air is going to muffle this thing. See how different?
Actually, that's the track.
That's the normal chest sound. So how do we get back to that in the chest? We can't, unless we have disease. What kind of disease? Disease that eliminates alveolar air. How do you do that? Well, you could fluid fill the alveoli. Fluid is a good transmitter. What kind of fluid do we have available? Anything by urine. We can put pus, blood, serum. Alveolar hemorrhage, lots of pneumonia, lots of heart failure will give you back the tubular sound. The other thing we can do, we can squash the alveoli empty. And now we get back that. Okay, so folks, if this sound, instead of being heard over the trachea, which is normal, is now heard over the chest, tells you that you have fluid-filled alveoli or squashed alveoli. Which of these two mechanisms is at play in this cycle? Fluid-filled alveoli or squashed alveoli? Let's vote. Who votes for fluid-filled alveoli? Raise your hands. Who votes for squashed alveoli? Raise your hands. And the answer is squashed alveoli. Because if it had been fluid would have made the interstitium first soggy. And that means that when you breathe, it will crinkle like cellophane. You will get extra sounds called crackles. So folks, squashed alveoli. What kind of squashing? From the outside. A pleural effusion, a collection of fluid in the chest, will squash this and by gathering as a result of gravity, would squash it at the bottom. So the top, fully aerated, will give you vesicular sound, the ones below. The mid part will squash the alveoli, but not the airways, and now you will get this tubular sound. The bottom will squash everything, and you get the sound of silence, which incidentally was written yesterday, 50 years ago. Let's move on. Next sound, this crinkling. Let's hear it. Sounds like cellophane. Okay, so these crinkling sounds are called many things. If you're in England, they call them crepitations. If you're in France, they call them runs. Make sure if you have a French person on the team, you don't call them rails, they get offended, it's ruts, which is French for run. And here in the US, we call them crackles. They all mean the same thing. Let's review. In inspiration, airways coated with crap, with snot, will create air-fluid interface so that when you breathe, they will be bubbling. These crackles will be early in inspiration, will be coarse, will be low-pitched, big pipes, bronchitis. Conversely, the ones you just heard come from the periphery of the airways, not the central, the peripheral airways. And what you got here? What you got here is a squashed peripheral airway, so that the central pressure is high, but the distal pressure is low. When the person breathes, he will reopen up and create popping noises. That's what these things are. Let's hear them. So let's review. If the crackles are early in inspiration, bronchitis, air fluid interface, snot. If they are late in inspiration, you got the squashing sound. And the squashing comes from high interstitial pressure as a result of two things. Either scarring of the interstitium, pulmonary fibrosis, or fluid filling of the interstitium. Now here's a question for you guys, which you should be able to answer. These crackles are due to scarring of interstitium or fluid filling. Let's go. Who votes for scarring? Raise your hands. Who votes for fluid? Okay, folks. Can you hear the breath sound in the background? Is it Darth Vader or is very audible? What you get is mostly the crackles. There is not a lot of Darth Vader in the background. Which means that the alveoli are air-filled. Darth Vader comes from fluid-filled alveoli. If this had been fluid in the interstitium, it would have been very likely to percolate into the alveoli, and you should have had tubular breath sounds. This one is scarring. I want you to use this algorithm. If the breath sound is vesicular, that's normal, but it could be tubular. Then move on. Do I pick up late crackles? If you don't pick them up, you're normal. If you do pick them up, it's scarring. The one we just heard, pulmonary fibrosis, because the presence of crackles and tubular tells you that this is fluid. Fluid in the alveoli and fluid in the interstitium. Lastly, tubular, Darth Vader, in the absence of crackles was the very first case. That's the way to approach it. It is simple, but it's not simplistic. We'll help you out. Is it possible to separate these sounds easily? Early, mid, late crackles. The Finns have looked into it, and it's a toss of the coin. But it's worth your time. Okay? All right, let's move on. Very important then, number one. You're in Bolivia. You're examining a 44-year-old South American revolutionary with a long history of lung disease. He was even coached to be schooled at home as a child as a result of this. Mother spoiled him. He's a physician, but he loves Cuban cigars. And he's got out, which is not a good idea. And now he finds himself in the jungles of Bolivia. And he's seeing you, but he can't talk. And here's what he sounds like. So you say, listen, some cortisol, stop smoking those cigars, and come back and see me in 2 weeks. He never goes back because he gets grabbed by the CIA and shot. He died of acute lead poisoning insofar as he gets shot. This was Che Guevara and his asthma. So, wheezing, folks. Wheezing is not produced like the tone of an organ pipe, where the diameter and the length correlates with the pitch. That would be fantastic if that were the mechanism. The mechanism is the Bernoulli principle. Rapid flow through a normal airway does nothing. But if the airway is narrow, you start causing fluttering. And if the airway is even more narrow, the fluttering increases till finally makes a noise. So it's like the reed of a toy trumpet. So it's really the force of flow that does it, more than the cavity. Now, what I don't want you to miss is my favorite patient, who's my daughter. Here, picture in front of Daffy Duck, because I always told her he's my hero, and when I come to a fork on the road, I always ask myself, what would Daffy do? But the point is that she used to be a teenager. And having a teen daughter looks good on your CV when you apply to heaven. So I had a teen daughter, and we were having some enlightened conversation one day driving through Yellowstone National Park, and then became an enlightened silence, and we passed the first aid station. And I parked, and we started going towards these calderas as fumes. Now you have to know that at that time my daughter carried the diagnosis of exercise-induced asthma, which I never bought. But basically, GP gave her an inhaler, which she flashed out each time she wanted to impress a guy. So we start walking, and she starts going like, Notice, I mean inspiration. That's not asthma. That's stridor. Dad, I'm having an asthma attack. I'm having an asthma attack. I said, Gemma, stop the shit. You know? And then she comes down and she said, Dad, what the hell? I said, well, you close your voice box. Now imagine I hadn't figured it out. I would have rushed her to the first aid station. Those guys first treat and then think, if anything. They would have got her better because she had nothing. I would have felt guilty. Since I'm Catholic, I would have felt really guilty. I would have bought toys and set her up to do that again and again and again until they show up in my office with fractures from all the steroids from nothing. What do they have? Vocal cord dysfunction. They don't even know they're doing it. 1 out of 3 severe asthmatics have that. So, if it's an inspiration, it's right. If it's an exhalation, it's still there. Listen to it. If it's louder here than here, it comes from here. All right, folks, we're getting towards the end. This is not a wheeze, but it's long enough to not be a crackle. It's snoring, low pitch. We call it a rumpus. And what is it? Local inspecific secretions. Nothing more. Now, this sounds like a crackle, doesn't it? Except inspiration and exhalation. Remember, folks, the crackles were only in inspiration. So this is a little unusual. I want you to visualize inflamed pleural layers rubbing against each other. It's a pleuritis. It's a pleural friction rub. Bleeding, localized, usually palpable, doesn't clear with coughing, which crackles might, and it's inspiratory and expiratory. Very important function. Inflammation of the pleura, pleuritis. Lastly, folks, let's combine. How's the breath sound? Is it a Darth Vader one or not? Yes. Are there crackles? Yes. So here we are. Fluid in the alveoli, fluid in the gestation, which is pneumonia. Classic pneumonia. See how the algorithm can help you? And lastly, folks, we have seen the breath sound, tubular vesicular. We have seen the extra sounds that mean pathology. Crackles, bronchi, wheezes, squeak, rubs. And now, the voice sound. This person is saying, 1, 2, 3, whispering it, and you can actually hear it. Now, if you were to put your stethoscope over somebody's chest and tell them to say 1, 2, 3, you would not understand much. Why? Because the vowels will not pass. And you need vowels to be able to understand. They're too high-pitched to pass the filter of the air. Now, vowels make your language very musical. The more vowels, the more musical. Let's take a very musical language at random. Italian. Italian has the audacity of having a word called aiuola, which has 5 vowels anchored around a single consonant. Trying to say that to normally aerated lungs, what you get back is German. No vowels whatsoever. So to put back the vowels, you need to consolidate the lungs. And now you can understand what they're saying. Whether they whisper it, whisper pectorinally, whether they say. But what we do, and when you go on the wards you'll see it, we often tell the patient, say E. And what you get out is eh, the voice of the goat. You got it. Lynette called it that. Alright, so one of us one day woke up and with a straight face went to the bedside and told this poor patient, why don't you say E? Why not O, U, A? When that happens in history of medicine, 3 requirements. A far-flung land, a British missionary, and lots of serendipity. The missionary was a guy named Shibri. He was in China, and he was asking Mandarin-speaking patients to say 1, 2, 3. In Mandarin, 1 is E. And when they had that, they sounded like A, and he wrote it up. Where is the serendipity? If it had been a Cantonese-speaking part of China, it would have been yet to yet change, it would have never worked. Folks, that's it. Let's review it. If you survey program directors, internal medicine, and family medicine, they all tell you this is important. And we don't teach it. Well, after medical school, only 1 out of 10 residency will teach you that. Only 2 out of 3 residency in cardiology will teach you that. So not a lot of teaching. What you get in medical school is what you keep. Is it enough? I tested residents in the past. I got a paper published on that. Compared to cardiology fellows, on this heart sounds I played for you, the residents in blue were not any better than the med students in green. What you get in medical school is what you keep. Those residents teach you, which basically means the blind leading the blind. When I did this survey, the program director wrote me back, you know, I was well trained, but now we have echo. And this other guy said, meticulous auscultation is an old art, but it's gone. Would you rather have a fellow with a 2D echo or a faculty member with only the stethoscope? Not true. Remember the clinical skills? You need that to order technology judiciously, economically, and effectively. Yet, as early as 61, in a textbook, they said that the only function of the stethoscope is decorative. Anxious patients feel better as soon as they sense the chest piece over their pectoral muscles. You have to buy a stethoscope for that reason, buy a cheap one. Now, Dr. McCoy of Star Trek doesn't have a stethoscope, so the future is bleak. He carries a tricorder that allows him to make brilliant diagnoses, and they go like this. Zoom, he's dead, Jim. So I get med students to listen to this stuff because, first of all, they need to remember the 500 repetitions, and secondly, because now the board's testimony. One med student who had been a disc jockey before got so sick and tired of listening to my CD that he put together a rap.
So wheezes are not clinically valuable, but they are often confusing. Let us now listen to cardiac event number 1, 2, 1, 2, 3.
Kentucky versus Tennessee. Kentucky is the This thing is now it's actually an icon, but it's real severe. But the point is, folks, you need sounds. You don't need this, but you do need sounds. If you want to get this, you get everything I said today. But the point is that you do need sounds because this, the data show, is as good as playing a musical instrument. Let's finish up. I was trying to show you that this thing is valuable for us in the science, but it's also valuable for us in the art of medicine. And medicine, like it or not, is a strange combination of art and science. You can't separate them. It's like those Siamese twins. When you separate them, you kill them both. If it's only art without science, it's quackery. And if it's science without art, it's cold technology, and you can't come out as a technician and all this. This is a tool that gives us back the art. Early detection of critical findings, serial inexpensive follow-up, the healing power of the physical touch, and last but not least, in time when medicine may not be a lot of fun, the fun of making a diagnosis by using your wits and your senses. Danny AMSA, who's a British poet, physiologist, and physician, wrote this poem on his stethoscope, and the first stanza said, "Over a young woman's abdomen tense, I heard the sound of creation, and over a dead man's chest, the silence before creation began." So folks, thank you so much for coming, and if you have any questions,
Thank you for doing a great talk. I just want to remind you again to fill out your surveys and let us know what you thought about this.